Good morning, ladies and gentlemen, and welcome to the SAIEE Biomedical Engineering chapter webinar on developments in contactless medicine. Before we start, a few webinar considerations. Attendees are reminded to ensure the volume is turned up on your device. Ensure you have a stable internet connection. This will ensure the streaming and audio will run smoothly. Attendees can ask questions via the questions panel located within the GoToWebinar control panel. By default, the control panel is located on the right-hand side of your screen. The chat function is reserved for webinar organizers and panelists to communicate with attendees. Attendees will not be able to chat with each other, however, are encouraged to ask questions. A recording of this webinar will be made available on the SAIEE YouTube channel, SAIEE TV. You will find the registration link to this channel in the chat box. Please register so you can receive notifications. The recording of this webinar will be uploaded under the SAIEE Biomedical Engineering chapter playlist. A certificate of attendance will be issued a few days after this webinar. I'd like to introduce you now to our host this morning, Dr. Pradesh Ramprasad, who's the chairperson of the Biomedical Engineering chapter, and he's a professional natural scientist and a group executive for research and innovation at the South African Nuclear Energy Corporation, where he oversees the development of new and existing technology in the fundamental and commercial nuclear space. He joined NEXA from the South African Council for Natural Scientific Professions, the legislated regulatory body for natural science practitioners, where he was a chief executive officer. Over to you, Pradesh.
Thank you so much, Mix. Good morning, ladies and gentlemen. Just making sure my camera works, and I hope you all can hear me clearly. Yes, please, ladies and gentlemen, welcome to the first engagement of the South African SAIEE Biomedical Engineering chapter. The chapter bridges the faculties of medicine and engineering, serving human sciences. And that being the case, the chapter welcomes all members to share their experience, knowledge, embrace further studies, short learning programs, development, postgraduate studies, especially in the area of human health. So with that in mind, and with that as our background, we decided to have an engagement today with you, have a webinar, and specifically, we are looking at the area of contactless medicine. And contactless medicine, ladies and gentlemen, is a discipline to provide practical solutions to the limitations of telemedicine in primary health care. Solutions have been developed to allow clinicians to deliver remotely primary care, and the range of solutions include Internet of Things to provide the clinicians with vital data such as blood pressure, blood glucose, blood oxygen, body temperature, heart rate, ECG, and extend to imaging. Now, what's important, live videos and photos plus continuous remote monitoring using wearables, giving the healthcare professional access to information immediately to assist patients and assist people. Today, our keynote speaker is Mr. Bayo Fabuyusui. He's the Senior Product Development Executive at Cloven Technology in Pilo. Bayo has led the in-house system design and integration of the diagnostic Internet of Things into telehealth platforms to deliver fully integrated and comprehensive contactless primary care. Drawing from his technical and business background, he brings collaborative engineering, technological design to harness the opportunities provided by 4IR to advance contactless medicine in primary healthcare. With that, Bayo, can I hand over to you to do your presentation? Thank you so much.
Thank you very much. Good morning, ladies and gentlemen. Welcome to the SAIEE Biomedical Engineering chapter webinar. We'll be talking about contactless developments in contactless medicine today. So I'll just go through the background of contactless medicine quickly. We cannot talk about contactless medicine without mentioning telehealth in general and telemedicine in particular. So telehealth started since the 1950s. with the advent of the telephone, consultation via the telephone, but it has developed rapidly over the decades to include many other convenience of the technology. So it has now included video conferencing capabilities. You have now integrated script system and many other integrations into it. So while it has provided the convenience of communication and record keeping, the other challenges are faced. So that led to the development of contactless medicine as a practice. So those providing solutions to those problems, which are having diagnostic data during consultation, which is a primary concern for most of the objective critics of telemedicine. So providing those solutions is the concept of contactless medicine. So now with contactless medicine, you have minimal or no interaction at all between the patients and the clinicians, regardless of their geographic location. So now in real time, the patients and the clinicians can have almost the same interaction as they have as in-person visits. So with technology now, the obstacles have been totally eliminated. So contactless medicine basically is a transformation of telemedicine. So we can go to the next slide, please. Next slide. So today, going by the objective of the webinar, would explore the latest technology in contactless medicine, regulations, we look at the limitations and lattice, and we look at industry collaborations and the future of telemedicine. So for exploring the latest technology, we'll look at the problems that have been solved by different classes of those devices that have been integrated. So I'll take the IOMT integration as a category of integration, while there are other categories of integration in contactless medicine. So the first category of integration, I'll take the IOMTs. So with the IOMTs are the Internet of Medical Things. So we have digital stethoscope, digital otoscopes, we have health monitors, and we have wearables. So there are many wearables on the markets now in South Africa and across the world. We have smartwatches, and now there are smart rings, and there are other wearables, and some are invasive. For example, we have some for continuous glucose monitoring. So in 2020, when the COVID-19 came, Discovery with under Discovery Vitality created something. I'll say that they took the lead towards contactless medicine. They brought in something called Title Care at the time. So Title Care allows the clinicians to have access to digital auscultations, which is sound of the lungs and the heart. Then it allows for external imaging and also for access to body temperature. So, however, it's a very, even though it's a very brilliant development and a very huge leap, others still wanted more metrics. They still want more metrics from their vitals. They still want access to blood pressure readings, especially historical readings. They want access to glucose. They want access to other vitals. So that led to the exploration of the inclusion of other IOMTs. So now there are other IOMTs now that can provide all of this during live consultation. Overview, this is just the overview before I go deeper into everything. The regulations it's picking up. If we look at in North America, there are many small organizations in different states of the US who are already in partnership with the academia, developing regulations and also training models that can be put into the academic curriculum for clinicians. So they're developing what could be a framework towards an effective regulation of this new practice. So, and going to industry collaborations, this new concept comes with a lot of industry opportunities, and obviously some of it calls for industry collaborations because not one industry or not one company or not one sector can do it all alone. It calls for interdisciplinary collaboration across many sectors. So we'll go deeper into that. Then the future of contactless medicine. What are the other things we can expect from contactless medicine? Contactless medicine goes beyond primary care. It extends to secondary and tertiary care. So there are a whole lot of other things coming in the future into contactless medicine that will make it more immersive and more practical and can improve patient outcomes. Next slide, please. So I already did take us through the background and the growth of contactless medicine, and taking us to where we are today. And I'll then explain how this system works, where we have practical solutions that has been solved in different places, and how other people can get on this system. And more importantly, when we talk about the problems that have been solved, there are also some problems that have been simulated. So they have not been practically, they have not been put into practical use, but they have been simulated. I'll give an example. We've simulated how contactless medicine can really assist in emergency triage when you have natural disasters and in preparation for future pandemic. So, and also we are also simulating how contactless medicine can be a very solid practical approach to reducing communicable diseases, because if you can reduce contacts between person to person, you can reduce the chances of spread of communicable diseases. So, and the limitations, we'll not only talk about limitations of around the legal limitations. I mean, we'll also talk about technological limitations at the moment. The current solutions, what are the limitations of the current solutions, and what are the areas of possible future improvements. We can go to the next slide. Okay, this slide is just taking us through the background that I described earlier in my introduction. The background here is talking about how telemedicine started. Our telemedicine, so this is talking about how telemedicine started in the 1950s with just voice, that's over the phone, and how it integrated video conferencing capabilities later into EHR integration, that's the clerking system and record taking. And then the 2010s is when the IOMT started coming in bits. So now most of the IOMTs are fully integrated. which allows almost the same experience, like person-to-person, in-person visits. So even though virtual consultation has been enabled, the communication aspect has been solved way back, but the other challenges posed by the lack of access to diagnostic data is what the IOMT's integration has come to solve. Next slide, please. So now fully going into this problem solved, we take in 4 categories here. So in these 4 categories, category A is the vitals. So thanks to available IOMTs now, during live consultation or live virtual consultation, the clinician has access to your blood pressure, your temperature, your blood glucose, heart rate, ECG, as they would want it during your physical visit to a clinic. So during a consultation, the doctor doesn't need to be stressed about what the treatment plan should be. That would its prescription spike your blood pressure? What's your current blood pressure? What was your blood pressure yesterday? He has access to live reading and as well as historical data of all of this. So the class B is the sound auscultation. So with the integration of digital stethoscope now, there are many. As we know, the stethoscope is one of the most important and most common tools used by clinicians. So in these days, we have many problems associated with the lungs. We have the flu is now called common flu. So because it's that common. So we have common flu, and we have people also who have associated diseases with the lungs, which, like asthma, pneumonia, COPD. So the doctor cannot adequately consult with these patients remotely without the integration of sound auscultation devices. So the digital stethoscope has come to solve this. So in real time, the doctor can just wear a piece of earphone, and the patient who has the digital otoscope place it on their chest, and the doctor can listen to your lungs in real time. So, and not only that, when the doctor is treating somebody, let's say the doctor is treating you for COPD, he can compare your sound data over a period. So during the course of your treatment regime, the doctor can compare the daily sound of your lungs and to determine if there is improvement or there is no improvement, if they must change your treatment path or not. So, and also it allows also clinicians to check for a second opinion. So because the digital stethoscope can record the data and allows the clinician to share this data with another clinician for a second opinion. So, and also it's very applicable in the training of the medical students. And it has also digital features that make, that gives better output. So those digital features, like your background noise cancellation, sound amplification, auto recording. So these digital features also enhance the final output. So this is obviously very much related to specialists like a cardiologist, but also very much related to GPs in every other discipline of medicine. So class C, for external imaging, the digital otoscope solves this problem. The problem of there's a problem of imaging during virtual consultation. As much as the technology has solved the problem of communication that you can see each other, which is called the clinician-facing feature, there are some places called hard-to-reach places, like inside your nostrils, inside your ear canal, inside your, your dental cavity. So this place is cannot be reached by your phone camera during virtual consultation or your webcam or your tablet camera. So the digital otoscope comes to play here. It's mostly shaped like a pen, so which you can insert into your nostrils. There's the color coding indicating it on the slide, so you can see one day you can insert the pointed part with the light into the nostrils, the ears, the mouth. So even the dermatologist can use it for skin examination remotely. You can use for wound monitoring, accident recovery. So there are many use cases to this. Then class D here is the remote monitoring. So remote monitoring are usually done through wearables. So the wearables now, there are bracelets, smartwatches, and smart ring, which we promote more. We specifically comparing most of the available wearables on the market. We specifically promote the smart rings more because most people wear them more than the watches. They take out the watches because it's not convenient to sleep at night, or some have other reasons around wanting to wear other watches that match their aesthetics. And the battery of the watch is not lasting long because it's got a screen. So some of those reasons make the ring more preferable, but all of them still work as remote monitoring devices, which can give periodic data to you, both the patient and the clinician. So all this data can be analyzed by the clinician manually or using clinical support tools, which are also available on some telemedicine platforms or contactless medicine platforms. So which can give them clinical guidance on the on the clinical decision making. So this technology, as I've explained, the class A for vitals, class B for sound auscultation, C for external imaging, and D for remote monitoring, all provide a comprehensive solution to telemedicine, which then gave birth to contactless medicine as addressing primary healthcare solution. So there are other solutions of contactless medicine, which addresses tertiary care, which is in primary care, like we'll talk about them as we progress in the webinar. Next slide, please. So let's looking at the current overview of contactless medicine and looking at the actual goal and objective of it. So measuring the current achievements against the goals. One of the goals of contactless medicine is improved outcomes, so which links on precision treatment. So we think during contactless medicine allows you to have more data, which obviously will lead to better clinical outcome. So, but because of certain factors, we can't say that goal has been entirely achieved. And those factors revolve around low level of tech penetration and low level of industry involvement, and there are so many other factors, and not enough data collected yet around this sub-region. And most people also have data, most of it aren't centralized. So there's so many factors, but the future looks very great around there, but we just aren't there yet. And the second is predictive medicine. So, like I said, a whole lot of data are collected in contactless medicine, thanks to the IOMTs. These IOMTs collect a lot of data which can be analyzed, and when all of this data are analyzed, we can use certain algorithms for prediction. So many prediction models have been built, and we see the more data that are being collected, so many things can be simulated and predicted in advance. So it's already looking very great for predictive medicine. Going to tech penetration is still very low, and there are so many factors responsible for that in Africa. We look at the GDP per capita, we look at which talks about affordability, we look at the involvement of financing, device financing, maybe by medical aids. Then also we look also at lack of local manufacturing, lack of involvement of local manufacturing. So all these reasons make tech penetration still very low, but still at a very healthy rate. So then we talk about the custom health premiums. So we think contactless medicine, going back again to the vast amount of data being collected, this can lead to customization or personalization of health premiums for medical aid members. So because when you have reasonable data about your members and you have predictive data, you can adequately measure the risk and cover the risk at the best possible price. So certain members who currently fall under the one-size-fits-all might maybe have to pay less than they currently paying, and which would encourage them to stay on the medical aid scheme. Because some people think now, okay, I don't usually fall sick. If my job doesn't provide the medical aid, then I don't need one. And we'll still talk about this as we progress, because it's still going to bring us to some discussion about the NHI that's coming, and how medical aids can also improve their membership through contactless medicine, how they can have reach to members beyond their current geographic location without necessarily having physical infrastructure. Next slide, please. Okay, now we're talking about the benefits of contactless medicine to stakeholders, which I'll start with clinicians. Part of the benefits of contactless medicine to clinicians is it gives them a wider patient pool, access to wider patient pool, because, for example, somebody who operates a physical practice in Soweto would only have access to patients around his locality. But with contactless medicine, the same clinician can service patients as far as Cape Town, KwaZulu-Natal, and this doesn't only boost their revenue, but also boost their wealth of experience. The more people they service, the more experience they are on the job. So, and it allows them to also provide their services to underserved areas. So then we talk about the efficiency and the flexibility. So contactless medicine provides clinicians with flexible working hours, which allows them to balance work and life. So you can choose your own working hours, and you do not have to think, okay, my practice is in a shopping center which closes at 6 p.m., so I have to be closed at 6 p.m. So I can decide to start work at 6 p.m. If you're consulting basically online. So it's already streamlined the work process for you, which is your, the admin work of, booking and pre-consultation, all of that. So it's all of those are automated. And also lowers your setup cost. So, and you also, part of the efficiency, you have access to advanced online clinical tools that assist you in assisting you in the outcome of your clinical decisions. So, and the third wider benefits to clinicians is the reduced exposure to diseases. So, in-person visits exposes clinicians to being infected by communicable diseases. So, and the online consultation reduces that, which lowers your downtime as a clinician, and it's also reduces the risk of you as a clinician transmitting the same disease to your future patients. Next slide, please. So now we're talking about the benefits of contactless medicine to the patients themselves. So cost saving and time saving is one of the most highlighted benefits of contactless medicine to patients, because you essentially only pay the cost of consultation. You do not have to worry about your travel costs to and from the doctor's consultation room. And also you save the driving time or travel time. So when because at times when you include the driving time, it's not very convenient for you to attend the consultation appointment. So then second one, it's very patient-centric. So because it's easily accessible, which means you can get on your device, your phone, your laptop, or whatever device, and get an instant booking. Search for your doctor, get an instant booking. So it's easily accessible, it's convenient, it's personalized to you, because you're on your own profile there, your data is there, and you have your, when I say your data, it's your historic medical records. So, and you have data from continuous monitoring. There's privacy, because sometimes not everybody wants people to know, okay, I'm at the doctor's waiting room, so some people want discreet consultation, then it's engaging, and it's secure and safe. So it's very patient-centric in that sense, that you feel involved in the personal management of your health. So then the last one on the patient benefits is the improved outcomes. So when it's affordable and convenient, it's not discouraging. People will seek consultation as soon as they do not feel okay, and this leads to early detection of diseases, and early detection obviously leads to early intervention, and which would eventually save your costs on complications. And this large data from continuous remote monitoring assist in the diagnostic accuracy. So, which on the broader view gives you improved outcomes. Next slide, please. So the next slide, I'll be talking about the benefits of contactless medicine to medical insurances. So contactless medicine saves costs for medical insurances, both on the long term and short term. So for example, on the short term, saves them on the associated costs with hospital visits, and on the long term, it saves them on the management of the illness or diseases, because you're able to avoid hospitalizations and complications. The other day, I was speaking to somebody. We comparing the cost of diabetic complications, cost of amputation, and you know, if you have high blood pressure, some people have to have certain surgeries, triple bypass surgery. These complications are in millions. So, and if you consider cost of ICU hospitalization per day, you can save all of this. Then the second one is reduced healthcare utilization, which is very similar to what I just explained. That you have reduced or no use for the physical facilities at the clinics. So which also reduces costs because you get most medical services delivered to you virtually. Then the third one is enhanced member engagement. So when with the convenience and the type of technology that comes with contactless medicine, it allows or it encourages members to, you know, it can be used. So these tools can be used to encourage members to participate in wellness programs, you know, preventive care initiatives. So these are engaging and immersive for the members themselves, and they are already used to doing all of these things online. So, and fourth one is data-driven insights. Medical aids have a very big advantage with decision making based on data. So with so much data that's been collected, they gain insight into healthcare trends, utilization patterns of certain services or medications, and they see population health metrics. So leveraging this, they can tailor interventions, quick interventions, identify high risk, and optimize resource allocation effectively. So, and the last one is the flexibility and scalability. I did mention earlier that medical aids should see contactless medicine as an opportunity and as a whole, an opening to a whole new industry. There will still be many discussions around cross-border services, cross-border medical services, because since the advent of telemedicine, there's been many patients from other countries who would want to consult with doctors from other countries. So there's been limitations in terms of when the doctors write you scripts from another country, how do you get your pharmacy, your local pharmacy to honor that? So, but medical aids and medical insurances have a huge role to play here because it allows them to provide medical coverage to patients beyond their current geographic location. So it's a whole new sector or opening for them. Thank you. Next slide, please. Let's go to the benefits of contactless medicine to governments. So I'll discuss this under 3 broad topics. We'll talk about data-driven policies and SDGs. Just as the medical aids can gain insights into health trend, disease pattern, and population health metrics to make informed decision on their resource allocation and stuff, the governments can also take advantage of this to make informed policy decision on effective resource allocation. So, and this, they can all as well monitor the outcomes of this to determine if it has met the initial goal or not, and adjust it accordingly, still using the data as a guide. So, and there are associated SDGs with the delivery of portable healthcare, especially primary healthcare. So it's part of the SDGs that every citizen of every country should have access to primary healthcare. But it will take, as we all know, it will take a very long time for the government to build physical health facilities and equip them in every remote location in the country to attend to the needs of every citizen. So even in the cities, many health institutions are already overwhelmed. So this says one thing, that physical infrastructure isn't the only answer. And since technology has allowed us, I think contactless medicine would allow us to quickly reach these SDG goals. So number 2 is around future pandemics and natural disaster. So in preparation for future pandemics, natural disaster, or crisis, government can take advantage of contactless medicine to remotely deliver medical services like virtual triage, screening, and remote care during these emergencies that might overwhelm the existing physical health facilities. Some people would, even in case of future pandemics, there are some people would prefer home hospitalization, but without diagnostic data, the clinicians can't exactly work on them. So contactless medicine solves these problems. And the last one, if we look at disease control and growth. So virtual consultation would reduce the risk of disease transmission, which can reduce the transmission of communicable diseases by up to 80%. So, and access to the data would also guide them on how they can also deploy measures to control the diseases. And most importantly, around growth. New innovations like this always stimulate the markets, create jobs, while it's solving the problems it's solving. Next slide, please. So our company's approach to telemedicine. So at Cloven Technology, we have devised certain intricate and strategic approach to contactless medicine. So I'm a senior product development executive at Cloven Technology, and I've been personally responsible for the integration of these IOMTs into existing health platforms, and also have developed some health platforms, which also these IOMTs are integrated into them. So our approach is not only working on our own platform, but also extending our solution to other people who have their own existing platforms. So for example, IOMT and EHR integration, we provide SDKs to hospitals, clinics, and medical centers with existing EHR and or HMS platforms for direct integration. So those who have their own platforms, their own EHR platform, clinics, or any medical center, and we can provide them the SDKs or directly assist them with integrating these IOMTs into their platforms. So they can, from the existing platform, provide contactless medicine services. So these devices would report directly to the existing platform, depending on the interface. But we have developed a streamlined process that can allow easy integration. If their own in-house experts can do it, but it's a service we can also provide for people who want to integrate IOMTs into the existing platform. So number 2 is the integration of IOMTs into telehealth platform. So there are many telehealth platforms or telemedicine platforms now existing around South Africa, around Africa, and most of them do not have integrated IOMTs. I have seen the Discovery Vitality platform. They do have integrated IOMTs. However, there are so many other virtual consultation services without integrated IOMTs, which we think can take advantage of this. So we provide the integration of IOMTs into the existing telehealth platforms for those who have it. And the third approach is we developed a contactless medicine software, a mobile application. It's a mobile application that delivers contactless medicine as well as personal health management. So the contactless medicine service on it is it can provide your virtual consultation as you would have it, the clinician facing virtual consultation with the electronic prescription features, sick notes, electronic appointment booking, but it has full integration of all of our IOMT devices, from the remote health monitor for vitals, digital stethoscope for the sound auscultation, a digital otoscope for external imaging, and the smart ring and a smartwatch for continuous remote monitoring. So, and for the personal health management feature on it, it has a pill reminder that synchronizes automatically with your prescription. If you have a prescription coming from the platform, it's got hydration reminder, exercise reminder. There are online clinical support tools for the clinicians to support the outcome of the clinical decisions. And we think this is a practical solution from our company to solve the problems that we think that we identified from telemedicine. So this is our own products that speaks to our that communicates our solution in the area of contactless medicine. Next slide, please. So case studies on successful integration of IOMTs and training provided by Cloven Technology. First was Lower Yizo Clinic. Lower Yizo Clinic is in the Eastern Cape, and it's about 40 kilometers on the gravel road to the nearest health center. So Lower Yizo Clinic is actually a health post with few nurses, and they made contact with us in 2023 and explained their background to us. So Lower Yizo Clinic actually has a significant background, and it's a self-sustaining clinic in the community that's built by communal efforts, but lacking essential personnel and lacking essential equipment. So upon contact, they reached out to us at Cloven Technology as well as an American university, which sent in personnel to train them, and we provided the devices. So, and also training on these devices. So this devices allows Loizo Clinic to communicate instead of traveling on the gravel road for 40 kilometers to the nearest clinic. It allows the nurses stationed at Loizo Clinic to communicate to the clinicians at the nearest clinic, which is 40 kilometers away. So they can now take patient vitals and communicate this directly with the doctor at the nearest clinic, which is 40 kilometers away, and the doctor can provide consultation services virtually. So this has greatly relieved the burden of travel on the people of the community of Loizo, and they did write a report after using this system for a few months. They did write a report to us explaining how the members of the community have benefited from it, expressing their gratitude to us, and hoping for even more collaboration on future technology. So this is a remote clinic, and this is a very remote village, but this technology has brought a very huge relief to the people. It's brought a solution that has entirely solved what they thought is a big problem. So second one is Title K. In the beginning, previously, I mentioned Title K, as was introduced in 2020 by Discovery Vitality. So, and Title K, these IOMTs take care of the sound auscultation, external imaging through the otoscope attachments, and they allow the clinicians also to take patients' temperature. So not full vitals, but at least the clinician can take the temperature, listen to the lungs, and if there is need for imaging, the clinician has access to that. But it still leaves the problem of other vitals out, which is, some clinicians need the blood pressure of the patients, depending on the condition the patient is presenting with. So, but Title K as testified by many doctors, was at the time a very brilliant invention, and provided a solution that bridged a huge gap in the virtual consultation space. So third one is ambulance. So ambulance is the mobile application I just spoke about on the previous slide. So it's Africa's first fully integrated contactless medicine mobile application, which has full integration of all these IOMT devices I've talked about, the ones that take care of vitals, sound auscultation, external imaging, and continuous remote monitoring. And next slide, please. So looking at emerging technology in the contactless medicine space, the VR technology, first of all, is a very promising technology in contactless medicine because of the immersive experience it provides, and the depth of the immersiveness is it's really outstanding. So we've seen practical simulations, and we have been working closely with some other tech companies to experiment the medical applications of some of the VR technology. So VR technology, it gives added depth to the delivery So one of it is the extended reality. So the extended reality is part of the deliveries or deliverables of the VR technology that would be very applicable for contactless medicine in the future, because it will bring more immersiveness to the reality between clinician and patients, regardless of their geographic location. So the second one is digital twin. So digital twin, with the advent of IR, digital twin is been explored in many industries already. Even in the construction industry, digital twin has been explored in many industries, military and stuff. But in the medical field, it promises so many revolutionary changes because the prediction models that can be explored on digital twin, you can safely explore what will be the side effects of a medication on a digital twin of a human being. You can safely explore, safe human dosages for new medical discoveries or pharmacology discoveries. So digital twin is another technology to look at in the contactless medicine space. So, and the final one I will be touching there, obviously there are others, is robotic surgery. So it's not fully implemented across all surgery specialties, but guided robotic surgery is already in use in many medical centers around the world. So, but in the future, we predict unmanned robotic surgery will revolutionize the tertiary healthcare, especially to perform delicate surgeries like the neurosurgeries and other delicate surgeries around delicate nerve endings and the tissues. Next slide, please. Oh, okay, thank you very much. I think that comes to the end of my presentation, and I hand over to Prof. Naidu now.
Thank you. Well done. Thank you. An excellent presentation.
Thank you so much, Bio. Really appreciate that. See, Prof. Naidu has his camera on, so I won't put mine on. And this is really appreciated. Of course, there are a few areas that we will have to discuss going in a little later. But for now, let me take a moment to introduce you all to our moderator for the morning. It's Professor Pat Naidu. Professor Naidu is a visiting scholar in the Department of Mechanical Engineering Science, Professor of Practice in the Faculty of Engineering and Built Environment at the University of Johannesburg. He's a Fellow of the Academy of Engineers, a Fellow of the South African Institute of Electrical Engineers, a Senior Member of the IEE, which is the Institute of Electrical Engineers in the USA, also holding membership at IET in the UK and SAIEE in France. He's a registered professional engineer, a specialist consultant in electrical engineering, electrical energy and power systems. With that, I'll hand you over to our moderator, Professor Naidu. Over to you. Thank you very much.
Thank you, Chair. Thank you. Thank you to our presenter. An excellent presentation. And I welcome both you, Chair, and the presenter to join me on the platform as we go through the second part of the session, the question and answer part and the moderation thereof. I'll lead first with the question that has been posted by Brian Goomans. Brian says he is pleased to see this development. I assume you're aware of the efforts of the MRC and MTN about 14 years ago to develop and deploy a telemedicine system. And there you go, some history there. What regulatory approvals do you have in place, or are you working towards that? And again, both locally, the EU, the FDA, etc. Any first comments on that from our presenter or from the chair?
I do have a comment on that. Currently, most people who operate telemedicine platforms operate based on the clinical licenses that they've obtained. So, which means you must have an existing physical clinic, which is already licensed and approved by the government. Then you can offer virtual services on the same license. So, but interestingly, many people have been discussing this, that to lower setup costs, people should also be able to be licensed to operate virtual services only without incurring the cost of physical setup. So if you have the, let's say you do have the medical license to operate a clinic, then you should also, without incurring the cost of the physical cost of clinical setup, to get a license to operate virtually. So, which isn't the case at the moment, but in the future should be the case. That's my comment on that.
Oh, thank you, colleagues. Those in the attendee platform, we encourage you to type your questions in the question panel. The platform allows us to do that, and we will then be able to post your questions and have them answered. Thank you to that first one from Brian. And again, we very much at the deep introduction of this topic into societal application. We currently in the thrust of the fourth industrial revolution, whereby we're getting the confluence of the various factors are all coming together now. Technology, the skills to drive the technology, the manpower, the environmental factors, they all are driving it in that direction. So it's all coming together now. I know 14 years ago is a decade plus, and it certainly has matured. And we're now deep in that fourth industrial revolution space. So definitely a topic that's going to gather momentum as we go into time. And in that respect, I would like us to talk around 3 points that I've jotted down here. Firstly, in terms of the whole thrust forward from data to information to intelligence, I think that space is widening, not just in the medical faculty, but in all faculties, in all spheres of application. And we should firstly reach out to our universities that have got biomedical engineering departments now formally established. I know the University of Witwatersrand, Faculty of Engineering and Built Environment, has a formal department of biomedical engineering. The same goes for the University of Stellenbosch, very much a formal department of biomedical engineering. I know at the University of Johannesburg, it forms part of the Department of Mechanical Engineering Science, and similar at the other universities of science and technology. And what I would recommend to colleagues, and both colleagues on the chat and to the leadership of the chapter, is we should reach out to these departments and possibly, go across to WITS and UJ and Stellenbosch and have a talk with the departmental heads, with their student population, both postgraduates and undergraduates, and share the presentation that Bio's just shared, and take a conversation and see best how we can deepen the knowledge base around this wonderful technology that's coming to the forefront. The second thought I would have, and maybe before I go into the second thought, any comments from Chair and from our presenter on that proposal? Over to you. First, let me go to the presenter, then to the Chair. Bio, over to you.
Okay. Is there a question?
Yes, not just a comment. What I recommended that we go and sit down with the biomedical engineering departments and have a conversation across the table. and deepen the state of the art in this sort of field of contactless medicine. Over to you.
Yes.
Your thoughts on that?
Yes. Thank you very much, Prof. I think that's a very welcome development. As a company, we're looking for collaborations with the industry players, the academia, to obviously deepen this conversation. We explore different use cases, explore the current limitations, and explore areas of possible improvements. So I think for us as a company, it's a very welcome development.
Thank you.
So, and I think some white papers can be produced out of this.
Excellent, excellent. Let's do that. Chair, your thoughts on that? Chair,
Yeah,
Dr. Ramprasad.
Thank you so much, Professor. I appreciate. I apologize. I think there's a challenge with my internet, and I've just lost the conversation in the last few minutes. I'm just trying to see how I can fix this. So
that's all right. Yeah, we will support it. I'll brief you further on that.
Thank you so much.
Thank you. Yeah, in that respect, we've also got at the different universities our student chapters. And I think it's the student population that we need to bring into the conversation, as they would then be able to carry this forward into their careers and their growth and development. So we'll actively involve our student chapters as we walk through the corridors of the various campuses. And colleagues on the chat are also welcome to join us at the chapter and to become part of the conversation and the delivery process going forward. The second point I would like to raise to our presenter, Bio, and you've mentioned it in your chat, is that of industry collaboration. Industry collaboration, and you did make note of Discovery in particular and the Vitality program that they had initiated during the start of the COVID pandemic. And I think Discovery Vitality is certainly a partner that will embrace the concept of contactless medicine. And let us expand on that conversation with Discovery Vitality within the institute itself under the corporate partner umbrella. And again, I've looked to Mrs. Ming Savarboss, who's on chat also with us today, to reach out to Discovery, to Vitality, and to bring the contactless medicine conversation onto the table, and for us to talk around it and see best how we could explore and expand the corporate partnership between ourselves as the institute, the technology partner, in this case Cloven Technology, and again Discovery as a corporate partner. So we'll build on that program going forward. Any first thoughts from your side, Ming Savarboss? You on the chat?
No. Good morning, ladies and gentlemen. Thank you, Pat. Yes, that's a great idea. I believe I do see that there is some positive outcomes from this webinar today, and of course going forward, bringing Discovery on board together with Cloven Technology, and we just watch the space that we will be in contact with them and keep you in the loop. Thank you.
Right, excellent. No, thank you for that. I know the various health clubs also have got various programs, to stimulate activity and stimulate member regularity at the various health clubs. So we could definitely tap into the data, the information, the intelligence that contactless medicine brings, and we could develop that going forward. I just want to go back to Brian Koeman's point, and Brian Koeman's point, he further expands on the requirement for regulatory approval. I fully concur with Brian that definitely there's deep regulatory requirements, both in the engineering and medical faculties, in terms of new technologies and the introduction of new technologies into the market. Definitely, and again, using the good house of the South African Institute of Electrical Engineers, we have good communications with the South African Medical and Dental Council. We'll build on that aspect of regulatory involvement and regulatory guidance as the technology gathers penetration into the market itself. So, Chair, make a note of that comment, that we need to bring regulatory agenda to the forefront as we develop the conversation going forward. Thank you for that, Brian, and you're most welcome to join us at the chapter and to guide us as we lead on the path of regulatory conversations. The third point I would like to reach out to in terms of our presenter today is that of our own very membership. You know, at the Institute, we've got some 6,000 odd members, all electrical engineers, all sort of technology knowledge, and they would be in a very good position to be your sort of, if I may call it, candidates out there in the field to test and work with the technology and to give you that much appreciated and required data. Much more data can be collected from various sites. We are a national institute. We've got centers located in all the principal cities across the country. So we should reach out to our own membership and then bring them on board and share this with them as a member benefit, as a member value proposition, that we've got the Biomedical Engineering chapter that has got contactless medicine knowledge, expertise, and again, we could see best how we could roll it out to our members themselves. So you could get sort of 6,000 odd volunteers out there, all contributing data, and data is in real time. So a lot can be captured, a lot can be processed. We could get our telecommunications section to also overlap and bring forward their strengths in telecommunications, mobile communications, and see best how that can be expanded. So let's explore that idea further as we go into the conversations at the Institute itself. Chair, if you make a note of that, we'll put it down as part of the proceedings of this webinar, and we could capture these thoughts and take it further. We've got a comment here from Andrew Spencer regarding medical aid support. Discovery appears to be one of the only medical aids that supports continuous glucose monitors. As an example of contactless medicine, the uptake is still to be slow. I agree with you. This is for type 1 diabetes, one of the most prevalent needs for contactless medicine and one of the easiest for the public to access the technology. Full agreement, Andrew, 100% supported. And I think let's build this comment into our conversation with Discovery, and I'm sure that we'll be able to get some traction with the colleagues out on the Vitality program. Definitely, diabetes is the cancer of the modern day society. It's deep, it's affecting a lot of our people, and we need to see best how we could bring forward knowledge that could be of societal benefit. So thank you for that comment, Andrew, and we'll capture that point going forward. And please join us also, Andrew and Brian, at the chapter itself, and become members with us. You're more than welcome, irrespective of your background. If you're not electrical engineer, you're still welcome. We need all the expertise and all the support that we can get from colleagues out there. I don't see any more questions on the chat. Colleagues, please post a few more questions. We could pick that up. We've got time. And if I may just continue the conversation around, how we could enhance the uptake of the idea itself and bring it forward. Oh, Andrew's a member, SAIEE member. Well done, Andrew. Well done. Thank you. Thank you for your membership. And we look forward to seeing you. Yes, please come.
Yeah. Professor Naidu, can you hear me?
Yes, I can hear you. Continue, Chair.
No, my apologies. I'm struggling a bit with the internet. I really apologize to everyone on the table. But I think the other question, which I didn't seem to grasp fully, was the fact of the ethical issues around the lack of physical examination of patients by a medical practitioner, making a decision on data that's obviously transmitted to his or her surgery which at times, depending on the device, obviously some devices, remember, there's hundreds of smartwatches out there. No one knows exactly how accurate each one is in relation to the other. Firstly, the medical practitioner is making a determination on, that's the first part to consider. But secondly, the ethical issue around utilizing this data, say, to make a diagnosis, or, for example, to change medication. I know during the lockdown, a lot of medical practitioners were struggling, with their patients, being able to get access to them, and individuals getting access to the medical professionals. So I think, yeah, there is an area, I think, also that has to be looked at around, when a medical practitioner is using this information. What about the physical examination part? Thank you so much, Jay.
No, fully agree. Definitely, there will be ethical factors that would need to be considered. And I think as we explore the regulatory approval process, you'll find all of that will come into the conversation. So therefore, it's very, very important that we embark on the regulatory journey and get the guidance and the support of the regulatory authorities, which will be an all-inclusive and collective communication with the various stakeholders. And again, we've got to appreciate that fourth industrial revolution is very much a disruptor technology. It's a displacement technology. But again, depends how we embrace it. It could be an enabler technology. So we've got to take the disruption part of it and downplay it, and take the enabling part and upplay it. And I think that's what we've got to do here now, and provide the leadership thereof. So the disruptor part can be minimal, while the enabling part can be sort of maximum, and we could then get the net benefits flowing to all. You're certainly going to find sort of job changes or score or job description changes amongst the stakeholders, and again, they've got to adjust and to embrace, but embrace it in the positive light. No, thank you for that. So we've had some few ideas, few thoughts, and I think it's definitely a chapter that we want to support, embrace, and deepen its operations within the institute itself. So I think let's do that now. We'll get the ideas onto the table. I'll speak to the chief executive and the office bearers, and we'll try and consolidate and get a lot more traction for the efforts that are being provided by the membership of the chapter. All right, I don't see any more questions. It's 12:17, and we've had a good almost 1.5 hours of communication and discussion. Chair, can I hand back to you, and then you could take over the formalities?
Excuse me, I just want to answer the question.
Please do. Please do, Bayo.
I just want to answer the last question. Yes. Thank you, Prof. And I think very brilliant question. So that's not a very serious concern as part of. Sorry.
Continue.
Okay. I was saying that's not a very serious concern. Okay, that's not a very serious concern regarding regulation. The reason for that is the devices that are integrated into the telemedicine platforms that make them contactless medicine platforms. Those devices have categorization. So, and these categorizations have to go through SAPRA. So SAPRA is South African Health Products Regulatory Authority, and unfortunately, devices like your smartwatches are not categorized as medical devices. So data coming from your smartwatches cannot be used for medical diagnosis. They can only be used as a guide. Like the doctor can only maybe use look at this data as a guide, looking at your sleep pattern and other relevant data he wants to look at, but he cannot make the clinical decision based on data coming from a smartwatch, because a smartwatch or a smart ring or a bracelet, they are unfortunately not categorized medical diagnostic devices. So these devices are very much different from the other devices that I've mentioned, like your remote health monitor, which is a Class B medical device. So the one we've integrated has gone through SAPRA. There is the digital stethoscope. It's a Class C medical device. So the actual medical devices are the ones the clinicians can rely upon for diagnostic decisions, not smartwatches. So I think that answers that question. So it's not a big concern around regulation. The devices that are integrated, well categorized according to the outlines from SAPRA.
Thank you. Chair, over to you.
No, thank you so much. And Bio, thanks for taking the time to address that. Is really appreciated. You know, I really am positive, especially about the fact that a lot of statistical data can come out of this, which also can help in terms of government planning. But with that, colleagues, ladies and gentlemen, I'd like to now start to round up and say thank you to those that were involved. Of course, firstly, from the SAIEE side, Minx, our boss, who basically is the coordinator of this webinar. I really appreciate the background work that she and the office at the SAIEE did and went up to in terms of preparing for this webinar. We really appreciate it. Of course, the SAIEE, which you call as board, is also thank you so much for allowing us the opportunity to use your platform to actually have this discussion. It's obviously based on the comments, we picked up something of interest to us as scientists and engineers. Our guest speaker, Bio Fabusuyu, thank you so much for taking the time to join us and enlighten us on this subject. It's obviously something very close to your heart, apart from the fact that you are professionally involved in this area. Yeah, I think there's a lot we've taken out of it, and I think what's so important shows the combination of obviously using science, engineering, and medicine, and what we can actually get out of it. Professor Pat Naidu, thank you so much, Prof. As usual, taking leadership in terms of ensuring not only this particular webinar took place, but also the chapter in general. You know, we all appreciate your leadership in this space. Finally, ladies and gentlemen, those of you who have taken the time, you have spent, I notice you have stayed online for the full duration of the webinar. Thank you so much for joining us. Thank you so much for being part of this discussion. I'd like to end to say, when I started, I very briefly introduced the Biomedical Engineering chapter of the SAIEE. We wish to grow this chapter. We wish to make it powerful. We do believe engagements like this, interactions like this will benefit not only the association, but also benefit society in general. So we have the platform. Let us use it and utilize it to the benefit of everyone, including ourselves, and I think society as a whole. And I think what's important, contact the SAIEE officers should you wish to get involved. And I think it's important that we all take an active role in this area to make it a significant difference. With that, thank you so much from me, and I really appreciate everyone's time. Thank you so much, Minx. Over to you.
Thank you very much, Pradesh. As you can see on the screen, if you want to get involved in the Biomedical Engineering chapter, please send an email to biomedicalchapter@saiee.org.za and join them if you want to get involved with the SAIEE and what they will be doing. In the drop-down menu, in the handout section, my apologies, please find the latest issue of the What Now magazine for you to quickly download, as well as the SAIEE Training Academy brochure for upcoming, for the CPD offerings to maintain your CPD credits. I'll give you a few minutes, and thank you very much, Pradesh, for chairing this webinar this morning, and for Prof. Pat Naidu, and of course, most of all, our attendees, and Mr. Bio Fabusuyu. Thank you very much for availing your time for joining us, and please look out at the Chronicle or the SAIEE website for our upcoming events and webinars. Have a good day, everyone. Goodbye.
Thank you. Bye.